concerns about radiation exposure in cardiac CT angiography are valid, but the landscape has shifted dramatically in recent years. The standard dose has plummeted thanks to better hardware and smarter algorithms. A decade ago, cardiac CT angiography was often criticized for doses ranging from 15 to 25 millisieverts. Today, in high-volume centers, using modern protocols, the median effective dose has dropped by nearly 80%. Now, for routine scans, it ranges between 3 to 5 millisieverts, comparable to or lower than the natural background radiation exposure for a year, which is about 3 millisieverts. Ultra-low dose protocols. In many academic and advanced clinical settings, scans are frequently performed at sub-millisievert, that is less than 1 millisievert levels, similar to a standard mammogram or a series of chest X-rays. The dose reduction is the result of several synergistic technologies. Prospective ECG gating. Unlike retrospective gating, which keeps the beam on throughout the cardiac cycle, prospective gating only triggers the X-ray during a specific window, usually mid-diastole. This alone can reduce dose by 60 to 80%. High-pitch helical scanning. For patients with stable low heart rates, the scanner can cover the entire heart in a fraction of a second during a single heartbeat, drastically lowering exposure. Low tube voltage, that is kVp, kilovolt peak. Reducing voltage from 120 kVp to 80 or 100 kVp, especially in patients with a BMI less than 30, significantly reduces dose while actually increasing the contrast to noise ratio of iodinated contrast. AI and iterative reconstruction. Deep learning based reconstruction algorithms can now clean up noisy images from low dose scans, allowing for diagnostic quality at levels that would have been uninterpretable 5 years ago. While the stochastic risk, that is the probability of inducing cancer, is the primary concern, it must be weighed against the diagnostic benefit and alternative risks. Comparison to invasive angiography. CT coronary angiography is non-invasive, avoiding the 0.1% risk of major complications like stroke, myocardial infarction, or vascular injury associated with catheterization. Comparison to nuclear stress tests. Traditional SPECT, that is single photon emission computed tomography scans, often carry a higher radiation burden of 8 to 12 millisieverts than modern CT coronary angiography. Real-world risk. Statistical models suggest the lifetime attributable risk of a fatal malignancy from a single 5 millisievert scan is roughly 1 in 2000 to 1 in 5000, which is significantly lower than the risk of missing significant left main or multivessel disease. It is worth noting that certain clinical factors still necessitate higher doses to maintain image quality. High or irregular heart rates may require retrospective gating to capture a clear window. Then prospective gating is not feasible. High BMI requires higher tube current or voltage to penetrate tissue, though AI-assisted reconstruction is mitigating this. Lack of sinus rhythm. Atrial fibrillation remains a challenge for low-dose prospective triggering because the rhythm is irregular.